President, Congress, Paddy Lillis, Usdaw, moving the composite motion on mental health and well-being. Conference, mental health is a trade union issue, and it is good to see such a broad range of unions involved in this motion today, from the supermarket to the postal sorting office, from the football pitch to the theatre. Workers across the country are facing a mental health crisis. Usdaw, alongside many other unions, is campaigning to end that crisis. Trade unions are helping workers to speak out without fear of stigma or reprisal. And Usdaw organises workers in a number of low-paid sectors where jobs and the workers' contribution to society are frequently not taken seriously, where people assume they are just working for a bit of extra cash or as a stopgap on the way to something better. And sometimes, even in the trade union movement, we hear comments like, for that money, they might as well be stacking shelves in a supermarket. Congress, I understand that those comments are born out of a real frustrations about people being undervalued in their own jobs. But they are also based on a false perception about the nature of retail work. Colleagues, retail workers have a physically demanding, target-driven, people-focused jobs. Modern technology puts them under constant surveillance and the threat of performance management, and they have to deal with rude and abusive customers, not just now and again, but every single day. And colleagues, last year, on average, over 280 shop workers were assaulted every single day. Over 70% of female shop workers surveyed by Usdaw experience sexual harassment at work. And it's not only the incidence of abuse or harassment that cause stress, anxiety and depression. It's also the constant threat that the next attack is just around the corner. These factors of feeling undervalued, under pressure and under threat are creating a toxic work environment for millions of retail workers across the country. And when you add in the difficulties of balancing work with the current responsibilities, it gets even tougher. You have inadequate family-friendly rights, contracts that fail to guarantee enough hours from one week to the next, and poverty pay that's just not enough to feed family and pay the bills. Usdaw's Time for Better Pay campaign has shown that 2/3 of low-paid workers believe financial worries are impacting on their mental health. The way an employer operates and how they treat their staff has a direct impact on the mental health and well-being of their workforce. But the law is not on the side of workers. Employers don't need to make reasonable adjustments until after a worker has developed a disability. This is simply not acceptable. Where an employer's policy creates a real risk to mental health, whether it's understaffing, unreasonable targets, low pay or short hours contracts, the employer should be under a legal duty to remove that risk before harm is caused, not after. And just as we protect physical health and safety with the requirements for personal protective equipment, we need to mirror this for mental health. When employers fail to make these reasonable adjustments, they need to feel the full weight of the law. Congress, trade unions need to highlight and campaign over mental health in the workplace. And for those reasons, Usdaw is promoting World Mental Health Day on the 10th of October. We want to see healthy workplaces, and that means risks to workers' mental health being tackled. We would like to see the whole trade union movement back in World Mental Health Day as an opportunity to highlight the risks to mental health that workers face on a daily basis. Congress, on behalf of Usdaw, I move the composite. Thank you.